Walker-Stanford. I'm the Director of Executives on campus. The JobSmart Career Hour is an opportunity for executives to come back to Baruch, to interface with you, to have discussions with you, act as mentors, act as leaders for you. And we have the honor today to bring back three great alum who have the opportunity to speak with you today. But this is not so much about me speaking, it's more about the clubs taking a leadership role, promoting this event, and working with our speakers today. So I'm going to hand it over to Michael Park.
Good afternoon. My name is Michael Park. To my right is Barry Wayne. On behalf of the Wall Street Club, we'd like to thank you, gentlemen, for making your time, giving us your time and an opportunity to hear more and learn more about the healthcare industry today. And Barry's going to speak, ask a question. First question.
So my first question to the panel, please give us some background about yourself and your company, and then we'll start from Mr. Potan.
I graduated Baruch in June of '66. We still graduated in June. And my dad had a small linen rental business. He had a major heart attack in first week of July, and I've been running the company ever since. And about 10, 12 years ago, when one of my sons entered the business, we moved to be 100% healthcare. So we serve 6 states. We rent linens to various and sundry, from a physician's practice to Mount Sinai to Columbia Presbyterian. We run 100 trucks, and we are a 100% healthcare company. So my perspective is from the support service to the industry.
My name is Michael Calder, and I graduated Baruch in 1986 in accounting, of course, and like everyone else, when I left Baruch, I went to work in accounting. But it was accounting in healthcare. I went to school in the evening while I worked actually right here at St. Luke's Roosevelt Hospital right here in Manhattan. And I've had an interesting career in healthcare. I actually worked in healthcare and ran healthcare systems at St. Luke's Roosevelt Hospital. I spent about 10 years there. I left and I moved my family to Connecticut, and I spent 9 years at Yale. And again, I ran their physician practice network at Yale for many, many years. And then I picked up my family and I moved again to Pennsylvania. And I was vice president of finance, revenue cycle, and operations for Crozier Keystone Health System, which is a large health system in the county of Delaware. And then I'm always a New Yorker. I got a call when St. Vincent went into bankruptcy to be part of the bankruptcy turnaround team, and I came back to New York. And I spent 3.5 years getting them out of bankruptcy. Unfortunately, they just filed Chapter 11 again. If you're into bankruptcy, I never realized you could file a Chapter 11 bankruptcy within less than 2 years, but it's unfortunate. And we'll talk a little bit about that in terms of the challenges in healthcare. And after I was done, I decided I wanted to do something differently. And myself and 3 partners, we formed Link Plus Partners. And I met these folks during the bankruptcy where they worked for the financial industry for many years, not in healthcare, and they purchased debt. So we decided, I was convinced, I operationalized a multi-million transaction with them during the bankruptcy, and when I was done, I joined with them and we formed Link Plus Partners, and we purchased debt and we do a lot of consulting. New company, new challenges, I like it a lot, and I'm staying on this side of the business for a while. I'm not in healthcare directly.
And good afternoon, I'm Jeff Blumengold, and I'm an undergraduate from '73, my God, and my MBA in public accounting was in '76, and I have a unique story, I think, related to how I got into healthcare, and it's simply, and you can appreciate this, playing cards on a Friday night, my standing poker game with fellows from Brooklyn College, and some 3 years after I graduated, I got a phone call, and a friend who I used to play cards with said, we're expanding our role as the fiscal intermediary in New York auditing hospitals. Would like to recruit you. And I said, I have a job. And he said, well, it's a unique field. And I said, well, listen, I'm willing to have lunch. And I really had no focus on healthcare at all. And they made me an offer, and ultimately I decided, well, I'm going to healthcare. So other than tell you that when I resigned at the company I was at, after having just been promoted, I was chastised by the CFO who said, "Why are you going into healthcare? That's, you know, mostly nonprofits. It's a very narrow, focused field. My God, there's no action. You'll never be a business person." And I said, that's a unique perspective. I think at 23 years of age, I can make that decision, and then if it's the wrong one, I'll recover. But it's an experience. It was interesting to know 20 years later, I received a letter from that CFO of a major company, I might add, asking me if I would help him with his job search and serve as a reference. Just a little irony. So healthcare is, of course, now 1/6 going on to be 1/5 of the GDP, and I had the good fortune, after having been recruited, to actually run the division I had been hired into. So the folks who hired me the day I met ended up reporting to me for 5 years. And at age 31, I found myself responsible principally for the Medicare program, all of the audits of all the hospitals in the lower 17 counties, and control of all the money in New York for Medicare, Medicaid, and Blue Cross, which at that time, at 31, it was an awesome responsibility. And I doled out the last year I recall, $3.1 billion in cash flow to the industry. So as what I consider to be a relative youngster, I had great experience. Moreover, and it's interesting with health reform now, back in '76, which is when I started in the industry was really in its infancy, because the passage of the legislation and the actual enactment occurred in July of '66. So really it was about a 10-year-old program when I came into being in my role, and had to interpret a lot of the things that nobody had thought about in terms of Congress's intent. So for me, it's been a tremendous learning curve, and almost akin to being a tax accountant. And that's how I characterize it, being highly specialized, but a great field, which as we go through today's events, we'll talk about. The company that I'm at today is Witham, Smith & Brown. It's 34th largest in the United States with 13 offices. But I've had an interesting career. I ran a regional health practice for 16 years at another regional firm that I think Michael may know, and that's Weiser, because they do a great deal in his space. And then I was recruited away, actually, and worked for 3 years on forensic and dispute accounting and investigations for Deloitte. So I got to travel nationally and help build a team there. And then ultimately, at this stage of my career, it became important for me to start to stay a little closer to home and watch my grandkids grow up. And consequently, I changed in beginning early '09, went to another regional firm that's now a 6-minute commute, even though I spend a lot of time on the road. And I'm pleased to do that. So I've had very varied experience, which we'll learn about as we talk through today.
Thank you very much, gentlemen. Our second question to the panel is, how did you, as an undergraduate student, prepare for a career in healthcare? And if healthcare was not your prospective career choice, how did you prepare for that career? Mr. Potak?
I was a straight C student. I was great at pool. I had no idea what healthcare was about.